Part 4: Sports Medicine. Common sports injuries and diagnosis. There are many types of sports injuries that can occur during physical activity or athletic competition. Here are some of the most common sports injuries and their diagnosis. 1. Sprains. A sprain is a stretching or tearing of ligaments, which are the tough bands of tissue that connect bones to each other. Commonly affected areas are the ankle, knee, and wrist. A sprain is diagnosed through a physical examination, imaging tests, and sometimes joint aspiration to rule out other conditions. 2. Strains. A strain is a stretching or tearing of a muscle or tendon. Strains are commonly found in the hamstring and groin area, and also in the lower back. A strain is diagnosed through a physical examination and sometimes imaging tests such as MRI, X-ray. 3. Tendonitis. Tendonitis is inflammation of a tendon, which is the tissue that connects muscles to bones. It commonly affects the shoulder, elbow, knee, and Achilles tendon. Tendonitis is diagnosed through a physical examination and imaging tests such as MRI or ultrasound. 4. Fractures. A fracture is a broken bone, which can occur from a sudden impact or repetitive stress. Fractures can occur in any bone, but commonly occur in the wrist, ankle, and collarbone. A fracture is diagnosed through imaging tests such as X-ray, CT scan, or MRI. 5. Dislocations. A dislocation occurs when a bone is forced out of its normal position in a joint. Commonly affected joints are the shoulder, elbow, and finger. A dislocation is diagnosed through a physical examination and imaging tests such as X-ray or MRI. 6. Concussions. A concussion is a type of traumatic brain injury that occurs from a blow to the head or body that causes the brain to move rapidly inside the skull. Symptoms of a concussion include headache, dizziness, confusion, and sensitivity to light and noise. A concussion is diagnosed through a physical examination and sometimes imaging tests such as CT scan or MRI. 7. Cramps. Cramps are involuntary and often painful contractions of the muscles that can occur during or after sports or other physical activity. Cramps can affect any muscle group in the body, but are most commonly experienced in the legs and feet. 8. Lacerations. Lacerations are cuts or tears in the skin, which can occur during sports or other physical activity. Lacerations can range from minor cuts that require only basic first aid to severe injuries that require medical attention. 9. Blisters. Blisters are fluid-filled sacs that form on the skin due to friction, pressure, or heat. They can occur during sports or other physical activity and can range from mild to severe. 10. Contusion. Contusion, also known as a bruise, is a type of sports injury that occurs when small blood vessels under the skin are damaged or broken, resulting in bleeding under the skin. Contusions can be caused by direct blows or impacts to the body during physical activity or sport. In summary, common sports injuries include sprains, strains, tendonitis, fractures, dislocations, and concussions. These injuries are diagnosed through a physical examination, imaging tests, and other diagnostic tests as needed. It is important to seek prompt medical attention for any suspected sports injury to ensure proper diagnosis and treatment.